Thanks for listening today. I want to be transparent with you. Besides hosting this podcast, I also work for Everly Health, our sponsor for today's episode. However, all views and opinions expressed on the podcast are my own or those of my guests, not those of Everly Health. Welcome back to Digital MB, the podcast where leaders in digital health talk about innovation, decision making, and how they think. I'm your host, Dr. Liz Kuo, and today I'm thrilled to have Michael Langer with us. So Michael Langer is the co-founder and managing partner at T-Rex Capital, a stealth fund at the crossroads of biotech and medicine and technology. So as an executive producer, he also made a recent movie with an IMAX film called Superhuman Body, narrated by Matthew McConaughey. So Michael's deeply involved in the nonprofit sector, serving on leadership boards of Beth Israel Deaconess Medical Center and global board of directors for Mass Challenge. And he basically has done a ton of work across innovation, both on Pear Therapeutics, and he also co-founded Old Silver, a VC firm that was focusing on healthcare and deep tech startups. So Michael, I'm really happy to have you here, and thank you for being here.
It's a pleasure. Thanks for having me.
So before we dive in, I wanted to share that Michael has been a very strong inspiration in the Boston ecosystem. And I just feel like there's a ton we could share about all the things that you do. So tell us a little bit about yourself, how you've seen your career in healthcare and all the moves that you've made, if you don't mind going chronologically and helping us understand.
Yeah, absolutely. I've been very lucky. I grew up in the life science sector my whole life. And in high school, I was able to intern for Polaris Partners, which is a great VC fund based here in Boston that invests in biotech and tech companies. Full disclosure, they've done a lot of work with my family over the years. They've actually invested in about 30 of my father's startups. And so in high school, I worked for them. And then I worked for a few of my father's startups in college. One was a material sciences company called Semprus Biosciences. They ended up getting bought by Teleflex. And then I worked for Living Proof, which is a hair product startup, where we actually really thought about how do you combine consumer and science to really rethink how you approach beauty. And then I also worked for a video game startup that was called Achille Interactive Labs, which ultimately got the first FDA approval for a video game specifically for the treatment of ADHD. And once I finished college, I ended up at Pear Therapeutics. Pear was a great place to start my career. Pear really was pushing forward the boundaries of how we think about software and medicine. And Pear grew super fast. I was employee 20 and we grew to about 350 people. I started as an analyst there and I worked my way up and became the head of M&A and license. And I led and did about 15 transactions across acquisitions, licenses out of academia, and then also purchases of small startups. And for us, we were very acquisitive because we were playing with Wild West space of digital therapeutic, where we saw a lot of opportunity for software programs that had clinical validation to be able to potentially or actually treat disease. And Pear ultimately went on to raise $400 million, went public in 2021 for $1.4 billion via SPAC. But unfortunately, the market wasn't really ready for it. We were the reimbursement pathway for these digital therapeutic programs was and still really, I think, struggled. The big payers weren't ready to really double down into giving payer coverage for these things. And that's really the model for these digital therapeutics. And so since Pear ultimately went under about a year ago, I think the whole industry has seen a reckoning and we'll see what happens from that. I still think that there's a lot of promise in digital therapeutics because the evidence really is there with the clinical data, but I think a lot has to happen with the business model to work, I think, for digital therapeutics to be able to be a successful business. Yeah.
Oh, I was going to say, so we've covered a lot. That's why it sounds like your focus for your fund and for other things is to really understand the reimbursement model, the next phases of how you scale companies. We also covered a ton. So you went through a host of really incredible experiences. I'd love to also understand how you've been able to connect the dots. What Steve Jobs always says, like learning to look back and say, how do you connect the dots across different experiences to now know what you know and to leverage all of that?
Yeah, absolutely. I can't say too much. The goal of the new fund that we're creating is all about the intersection of software, health, and biology. And some of that will be looking at software and health, specifically digital health. But yeah, I think tech bio, there's a lot of promise and we're seeing a lot of really exciting companies in this space where you can understand fundamentally how to use great software and coding to be able to optimize or advance biotech. But it's still early days there too. There hasn't been any great successes, at least from like a scale standpoint. There's a lot of really interesting and exciting companies, but I think it is still early. You asked about connecting the dots. About 5 years ago, our family created a small fund called Old Silver VC, where we did deep tech and biotech and health tech deals. And that was really our first foray in trying to think about, we have this really incredible ecosystem through our family and specifically what my father has done in the lab. And so we wanted to be able to extrapolate from that ecosystem. And so that's really what we did. And we leveraged those relationships that we'd built and being able to get into deals and see deals, but also being able to diligence those deals by leveraging a lot of the network of academics that we've been able to build a relationship with over time. One of the stats that I think we're probably most proud of is out of my father's lab. There's been
Mm,
students and they're now professors at 400 different universities. And so that's allowed us to
wow.
see quite a bit of deal work and be able to have a really incredible way of diligencing opportunities as well.
So you talk a lot about your father, Bob Langer, who I have the pleasure to know. And can you talk through more on a personal level how you think about your family legacy? Because you've mentioned this a few times and you've had some great experiences. How do you think about the world and what you want to leave behind? And how do you manage all of the expectations also?
Yeah, I feel very lucky. Yeah, I think it's really exciting and a real pleasure to be able to see, I think, the impact that he's had on the world. And I think also what that's allowed for the rest of our family to do in our careers as being stewards of what he's done, but in our own ways too. Me specifically more on the software side of biotech and now on the investing side. I think as we think about the future of biotech, all of these companies eventually are going to have great aspects of data science or AI or software that's driving these companies and the innovation around them. And so I think right now we're in an especially exciting time in history where we get to be at that sort of intersection and where that's proliferating in the way that it is.
For the listeners and viewers that don't know who Bob Langer is, do you mind explaining what he's done with his career and the successes he's had?
Yeah, absolutely. In the 70s, my father started at MIT and he really was pushing forward in the areas of drug delivery and engineering. At first, a lot of people pushed back on a lot of his ideas. A lot of people thought it was crazy how he was approaching his science. But over time in the 80s, a lot of what he was pushing started to become more mainstream. And by the
Yes.
time he was in his early 40s, he actually became the youngest member of all the three major science societies. And over time, that's, I think, proliferated significantly. His lab is now the largest in the world in the bioengineering space. He's the third most cited person in the world for his scientific contributions. He has about 1,400 pending or issued patents.
Did you say
Uh,
1,400? That's amazing.
1,500.
And
Uh,
how many companies has both he has spun out and co-founded several, but also how many has his own postdocs and people within his lab? I think there's a crazy stat too.
yes, he himself has co-founded about 40 companies. 27 of them have exited via M&A or IPO. The most successful of those is Moderna. And from his students, I think that there's probably several hundred startups that have been started. Biggest ethos from his lab beyond the obvious, which is how do we make a big impact on the world and help people, is
Mhm.
take and translate this research and actually make companies out. Because that's really what they found is the best way of making impact is taking the science, licensing that science, creating a company around it, and then taking that company and scaling it so that it can actually become ultimately a drug or a new therapeutic modality or platform that can be used in terms of creating great drugs. And they've actually estimated that about 2 billion patients have been impacted by those inventions that my father has been involved.
That's so incredible. Speaking of, I think, tech transfers and ability for universities to take what they know in the science and translate it into healthcare, I want to come back to that because I do think that there's a lot that we could do to be better at collaborating, both from the science and also the business and the terms around it to improve and encourage entrepreneurs to pursue. What are challenges that you see and things that barriers that we should break down in order for more companies and more initiatives to get started so that you can really commercialize it and get it into patients' hands?
I think there's a lot of really interesting ways that people are thinking about funding. And even recently, we've seen some of them, whether they're through VC funds, institute models, or even there's some companies doing things with cryptocurrency. I
Mm.
think the one really big one that we just saw was that new initiative that Stuart Schreiber will be leading, where they created a new funding model all around how do we essentially empower our scientists to be able to come through and be paid in a way that makes sense for them to stay, but also incentivize them to create new innovation. And
Mhm.
I'm trying to blank at the name of the new institute, but I think that's a really exciting one that I think came out a couple of months ago. I think there's a few VC funds that have new models around funding, like Curry Bio is interesting how they've thought about doing things. Obviously, some of these venture accelerator model I think are very interesting. One company that I advise called Molecule, I think is interesting how they're working on tokenizing IP out of academia and doing
Mm.
crowdfunding to be able to fund that. I think there's a lot of really interesting ways that we can think about funding models for these things, because ultimately it comes down to how do we get capital to be able to come into these things, and how do we de-risk them enough, incentivize people enough to want to do these things. And I think that really is the biggest question with all innovation is how do you fund it, and how do you scale it, and how do you do that in a rinse and repeat model?
I love that. I think the ways that you're thinking about rinse and repeat and being able to have certain models that work, I think from all the innovation that comes out of the Langer Lab, in addition to other areas, you've really figured out a way. And speaking of funding, too, the other area that's also very interesting is you're an executive producer for the Superhuman Body World of Medical Marvel, the IMAX movie. How did you end up getting involved in this, and how did you support the funding of it? Because I think it's a really amazing just experience to go through all of that, from investing to in startups to at Pear and now to this world that's in film.
Yeah, I think a big part of all this is storytelling. That's how any company even gets
Mm.
venture funding, right? I think they have to have the right component to make people believe that there's something incredible and big of an opportunity that they're able to solve. And I think that's probably the case for anything we do in life, right? We're all essentially a product that is being marketed into the world, whether that's
Mm.
anything, how do we get a job, to how do we approach life. And so I think in biotech specifically, there's a lot of that. And storytelling has not generally been something, I think, in biotech, at least from a public point of view, that we've been able to prioritize a lot. So I'm very proud of what we've done with Superhuman Body. It'll ultimately go into 150 theaters, and we estimate that in lifetime, about 40 million people will actually see the film. We raised money somewhat from private, some from public. We were able to get a significant amount from Edwards Life Sciences, and then the rest from different individual donors and foundations. And then we also got King Griffin and the Citadel through their philanthropic arms to come in too. And I think everyone had this common goal, which is how do we tell an incredible story of innovation to inspire the next generation of doctors, scientists, and engineers. And the IMAX production firm that I've worked with, McGilvery Freeman Films, they
Mm.
it really did an incredible job in the space. They've done 43 IMAX films. They did Everest, the largest, most successful IMAX film ever created, and a number of
Wow.
others. And I think this is really is just the first of many. We also have one on the brain that we're building. We have another one on climate. We have a couple of TV shows that we're building. We even have a comedy that we're creating. So we
Mm.
think there's a lot that we can do with these stories. And I think there's really a lot of riches here to be able to tell. So we're very excited about the prospects of what we can do with storytelling. And this certainly won't be the last that we will be doing.
Did you know that improving preventive care can significantly impact your health plan star ratings? Everly Health Solutions is the leader in at home testing for health plans. Their convenient, member centric approach has helped plans achieve industry leading results. In just 1 year, Everly Health Solutions helped a multi state Medicare group improve 15 of their plans by at least 1 star. That's a win for members, providers, and the plans themselves. Learn how Everly Health Solutions can elevate your health plan at everlyhealthsolutions.com. I really love that. This helps me think a lot about legacy. I've been thinking about it a lot too. What do you want to leave behind? What do you want to be known for? And what impact have you had on the earth, both from the people that you interact with today to the people that you may not affect directly, but indirectly, and the legacy that you leave behind? And I feel like this storytelling piece really creates impact if you can reach larger audiences. And you're actually quite data driven. You just quoted, you've been looking at this with being able to hit 40 million people. I'm inspiring 40 million. Even recently, someone reached out to me because advising on the scientific script, they were asking me, was I involved? And they actually said they just saw it because their son had leukemia and was treated. So it was really powerful for them. And the storytelling piece, like that is very interesting. Are you focusing on how you do your own storytelling too and in your own career?
I don't know that I've been all that thoughtful about that part of much, but I think, I try to be thoughtful about where I spend my time and the trajectory of the different things that I do. We only have a finite amount of time, obviously. I think I've been lucky to see how my father has managed his career, and he has a lot of different responsibilities. And so I think if you time box and if you
Mm.
hyper or do these things in a way to do this to be able to be significant in terms of time management, I think that's really the way to manage these kinds of things well.
You and I have talked about time management. This is a personal favorite of mine. What are some of your time management skills that you've incorporated to really enhance your productivity? Because I feel like you're very productive.
Yeah, I think I don't know how much of a life outside of work. The biggest thing is getting up early. I try to get up at 5 or 5:30 every day.
That's
I
early.
try to sleep by 9:30. I try not to eat more than twice a day, and I try
Mm,
to have it be pre-made meals, so I don't have to spend time making food. So I
mm,
basically just try to pre-bake most things in my life, so I don't have to spend time doing them. And then I generally try to plan significantly ahead in terms of plans. Like I will be
yes.
creating hangouts with friends like a month in advance, much to their excitement. So I don't know, things like that, like basically massive, aggressive planning.
That's great. And as long as it doesn't take more time to plan than it is to actually enjoy your life, because I think there are quotes about that that say life is happening when you're busy planning. So sometimes you have to watch out for that. I sometimes am, I think, a victim to that too. How about you talked a bit about not only legacy, but also how you interact and how you spend time. When you're looking at investments and people that you work with, how do you evaluate character or the people that you want to work with to figure out if it's the right setting for you, the right place for you?
Yeah, I think what I would say, we think about a couple things. Characteristic trait that we like to see a lot is persistence and
Mm,
understanding different things in their lives that they have done as an entrepreneur. Doesn't necessarily have to be as an entrepreneur, but where they don't give up, where they continue to move and push forward. I think creativity is another one that's super important. How do people think about things outside of the box and do things unconventionally? I
mm,
think those are the people that really excel as entrepreneurs because they're able to figure things out on the go and be very quick. And I think
yes.
third is adaptability and being entrepreneurs that take feedback well, that are seeing a problem and are able to pivot. And I think that those are the three characteristics that I personally like to see the most of. I guess the fourth special bonus is their ability to interact with people. I think that really matters a lot in terms of culture, in terms of being
Mm,
able to maintain talent, being able to work with their investors. So I think people skills becomes exceptionally important, especially for the CEO in
mm.
terms of their ability to be successful as an entrepreneur.
That's very helpful. I think a lot of it is you see a lot of technology or certain types of folks that may be focused on an area of expertise, but they may not have acquired what you just talked about, which is a well rounded creativity, adaptability, all those things that are actually pretty inherent, but also can be taught if you learn how to compensate for what may be a little bit more easy to be weak, or I would say even driven by pessimism. So it's like this learned optimism that is required to adapt and to focus on the future. I also wonder about some of the work that we're now seeing with AI because it's replacing some kind of manual work that we've always had to do. So you're probably seeing a lot of it in your own investments when it comes to biotech software and drug development and where it's going. Can you comment a bit on that too and what is the future?
Yeah, I think AI is obviously a term that is thrown around a lot. I would say that the most important piece that I think people don't talk about as much on AI, but it's probably the most important piece is the data that's being used to feed the AI. I think
Hmm.
we have all sorts of algorithms that are very thorough or can do a lot of different things that are important to what it's trying to solve. but if it doesn't have a lot of good data to be able to learn from and learn on, then I
It's
don't think
true.
it's able to do quite as much. I think it's also interesting, especially in biotech, to see, what are people actually doing with AI and where is it useful versus where is it more just like an add-on.
Yeah.
So I think right
Yes.
now we're seeing a lot of interesting and exciting aspects to the biotech industry in AI. I think the next couple of years we'll start to see what's real versus what has hype to it. And I think over the last 5 years, there's definitely been some strides, but I don't think that we've yet seen probably enough progress in terms of what that can do in terms of impact in the space for it to be something where people can point to examples of massive successes. But I think there is an enormous amount of potential. And there's no question that it will be a huge part of what we're going to be doing in the industry. And so
Yes.
something we definitely want to be following very closely.
This was an absolutely great learning for me about all the things that you've done to think about legacy, to be deliberate, to think about time management. Is there anything that you feel like we've missed before we go into sort of the hot takes and the questions that I love to ask always for every guest?
No, I think this is great. I just appreciate you having me on the show.
All right. It's been an absolute pleasure. I really appreciate you being here. So, the next 5 questions I usually ask are what's the best advice you would want to give?
Yeah, I think the best advice, especially assuming this is being put onto someone who wants to come into the industry, is you talk to a lot of people. I think the biggest thing that I am happy I did at the beginning of my career after I finished college was
Mm.
I talked to 100 different people. And I know
Wow.
when you talk to a lot of different people that you absorb a lot of different things that are important. You see the things you like, you see the things you don't like, you see
Mm.
the things that resonate, you see the things that make sense based on your own skill set. You learn, especially if you're really taking a listening view to this. I think that talking to an enormity of people is the best way, at least that I think people can learn and grow as people, especially when they're coming to.
I love it. I agree with that. If you have the time and then also being able to absorb and then start to collect notes and formulate your own thesis on who you are, what you want to do, what's meaningful. What about favorite business or life quote?
Favorite business quote. So I think that my favorite business quote is, I pulled it up.
That's great.
Is so Winston Churchill says, "Success is not final. Failure is not fatal. It is the
Mm.
courage to continue to count." I like that because I think it's true. Like I think it's super important that people continue, no matter what happens, to just keep going, no matter what. If you get slapped in the face 100 times, you just literally just keep going and trying to figure it. And that's why I like it.
I love it. I don't think you get slapped in the face very often, right? But I feel like even if you,
Yeah, when you're fundraising for anything, you get a lot of no's.
that's true. That makes sense. Being able to not take the rejections very hard. I've done that too. I talk about sometimes in my own life where I've applied to the Fulbright twice. And then when you finally get it, no one asks you if you applied once or twice or a million times. I had a lot of failures even taking the MCATs for med school. First time I just had to cancel my test. I just had my own sort of nervous breakdown. And I think what's important is people don't always ask. They only see the successes because of our social media culture. So being able to be open about it and vulnerable and sharing failures and being comfortable with accepting your own failure, taking some accountability and ownership, I think is key to moving into a more resilient culture. So I like that. What about the hardest challenge and how do you overcome it?
Yeah, for me, the one that I'll talk about is probably when I was 22, I dropped out of school. I called my mom on her 50th birthday. She was very excited. And I told her that I was going to leave school. For me, I felt like I wasn't really happy in school. I'm getting much out of it. And so I wanted to do something very different. And so
Mm.
I moved to Fiji, actually teaching English in a small village. And then I went to New Zealand backpacking. And then I went back to
Wow.
Fiji. And then I went to Alaska to do backpacking. And then had English in Thailand and Laos. For me, these were
Mm.
very seminal experiences of growth that helped me, I think, evolve more as a person. And then when I ultimately went back to school, I was more prepared and ready to do that. But it was hard because at the time when you're 22, your world is much smaller. And so you
Mhm.
think that being on the same trajectory as everyone else is incredibly important. So at the time, I had a bit of FOMO where it was like, oh, wow, like all my friends are going to be so much further in their careers than me. What do I do? And I think the important thing you learn from all this is you go on your own path. And people say that sounds cheesy and silly, but if you do, then ultimately, if one is to believe that the universe is putting you into the right position, then you're going to where you need to go. And so for me, that worked. And I'm very grateful that I did do that. And it was definitely the right decision for me.
That is great. I felt the same way, actually. I took 2 years before I applied to med school from college. So I took an extra year, worked for a nonprofit, and the second year was, at the time, I didn't even know what it was gonna be. It turned out to be a Fulbright, but I felt very behind. We had so many of my friends that went straight into med school. You finish college and bam, like in your junior year, you already apply and you already know where you're headed. And I think that time that you take off really makes you better, even though it's hard. It's humbling, but I think it makes you, like you said, understand who you really are. So thank you for sharing that. And then what is most exciting for you about healthcare innovation in the future?
Healthcare innovation in the future. I get most excited about the personalization of all these things. I think
Mm,
the more that we can have things attuned to specific people, I think the more impact we can have. And I think that is probably what gets most exciting, I think, about medicine is the ability to really understand each patient from an individual standpoint. I think we have a ways to go, obviously, to get there. But I think that's probably the most exciting piece of all of this.
great. Last question I have is, do you have any superpowers and what would it be if you could have one?
Superpower. I say relationship management is probably my best superpower. I think to do well in fundraising or business development or managing multiple modalities across projects, I think the only way that at least that I know how to do that well is through
Mm,
having an enormous amount of relationships. And that takes a lot of different abilities of understanding people, understanding what different people need, how much time to give them, how much space to give them, and managing hundreds of, if not thousands of relationships to do that well. And that I think is something that I feel like I have spent a lot of time working on, and is probably, if anything, that the thing that singularly has been most helpful in my career is how one does that well.
that's great. And if you could have a superpower, what would it be? I guess that's my final question for you
If I could, X-Men is definitely one of my favorite
too.
superhero shows. I don't know whom I would most want to have as
Beast,
in the.
Storm, Rogue.
It's definitely not Rogue. I guess Professor X is pretty amazing, like
Mm,
being able to hear people change what people think. But I think it's a lot of power to have. But I think he's probably the most interesting because it's the most cerebral. I think the others are more physical in terms of what they can do. So maybe aspects of his. I don't know if there's a specific one that I can think of, at least at this moment. Maybe forever memory. I think if you could remember everything, that would be pretty fascinating. Then you
I
could choose.
have heard, though, then
Yeah.
you will never forget people that have wronged you, and then you Ah,
Yeah. I think with all power then comes all sorts of secondary things that one has to manage.
that's true. All right, Michael, it's been a pleasure discussing the healthcare landscape with you. Your insights have been really incredible, and thank you for sharing all the personal and professional stories. You're very forward thinking, so I appreciate all of your enlightening comments and the impactful work that you're doing. So, listeners, for more of Michael's work, you can follow him on LinkedIn or email him at langer@trxcap.com. It's Langer spelled Langer. We'll link both in the show notes, and we hope today's conversation has sparked your curiosity and inspired you to explore further. So thanks for joining us. And until next time, keep on innovating.
Thank
Thank you.